I'd like to now tell you more about Extend Health. First of all, who is Extend Health? Well, we're an independent company dedicated to serving Medicare eligible retirees. So, what does that mean? Well, first of all, we really only do one thing. We work with Medicare eligible retirees to make the same sort of transition that you will be making over the next few months. We're an independent company. That means that we are not an insurance company. We're not owned by or controlled by any insurance company. However, we do work with over 65 different health plan carriers around all of the United States to provide you coverage to fit your individual needs. We say that we partner with those different insurance companies. We are objective. Since we're an independent company, our benefit advisors that you will be working with are objective in what they are going to make recommendations to you for your new healthcare coverage. But I want to emphasize that it will always be your choice what to enroll in. We will make recommendations. That's why PEB has hired us. And we hope that we will be your trusted US based benefit advisors. And when I say US based, I mean that. All of the people that you will be speaking with are in the offices in Salt Lake City, where I am located as well. So just a few hundred miles away from most of you. We're focused on one thing only, and that is helping each participant to make an informed decision. And if you have the information, we feel that you can make a confident decision. And that's what we really want to assist you with. Now, why did PEB choose Extend Health? Well, first of all, we're very experienced in helping people just like you. Over the last 5 years, we've helped nearly 300,000 people to make this same transition from a group coverage over to individual Medicare plans. The services of Extend Health are provided to you at no cost for the eligible PEB retirees, spouses, domestic partners, surviving spouses, and dependents. That's not only true today, but that will be true in the future as well. You will never pay any monies to Extend Health for our services. Here's just an example of a few of the companies and entities that we have worked with over the last few years to make this same sort of transition. I'm sure you recognize many of those names and logos, such as Avon and Caterpillar, General Motors, Ford, and now top and center. We're very, very pleased to be able to add PEB to that list of partners that we have worked with in making this transition. Here's just a timeline of how things will work for you over the next few months. The pre-enrollment began on January 31st. That's a period where we have initial conversations between you as retirees and the benefit advisors here in Salt Lake City. That discussion is aimed at gathering your prescription information and to set up a personalized appointment time for each of you that's convenient so that we can move further after April 1st into the next phase, which is our primary conversations between you and the benefit advisors. Those conversations between April 1st and June 30th are designed to analyze the different plans that are available to you, help you to make recommendations, and to finish enrolling into the Medicare plan that you choose. And then July 1st and going forward, we are here for post-enrollment support for you. We're going to be your long-term advocate, and we want to give you the support that you need for your HRA, for plan or carrier issues, for appeals issues, and for future plan options, because you may want to change coverage at some point in the future as well. Now, how does the exchange work for you? Well, first of all, as a retiree, you will work very closely with your benefit advisor here in Salt Lake. We have access to what we call the Extend Health Exchange. That is those 65 plus different insurance companies that we work with. And you working with the benefit advisor will get you connected to that exchange, and then we will take care of all of the paperwork that needs to go to the individual carriers, to the insurance company that you choose for your future coverage. Here's an example of just a few of the insurance companies that we partner with on the right side of this screen. Companies that you know and trust and recognize their names: AARP, Mutual of Omaha, Humana, and Aetna. And then you'll notice down at the bottom, for those of you who do live in Nevada, we've added some plans just for you: the Sierra Nevada Spectrum and Senior Dimensions. On the left side of this screen, I want to talk about the different Medicare plan types, because at Extend Health, we do work with all different types of Medicare insurance. There really are three different types. The first is called a Medicare Advantage plan. Most often it does include prescription drugs. So if you ever hear the term MAPD, Medicare Advantage Prescription Drug, that's what that stands for. The second type of plan is called a Medigap, also sometimes known as a Medicare supplement. The Medigap plan does not include prescription drugs, so we will need to add a prescription drug or Part D plan to that. We also, for those of you who are interested, do have optional vision and dental coverage available. As a note, there will be one PEB dental plan that will remain an option for you as well. Let's talk about the difference and the contrast and compare Medicare Advantage to the Medigap plan. First of all, because of the way this transition has been structured by PEB, all of you are guaranteed issue of any plan that you want between now and July 1st. It will be the same rates and benefits regardless of your health care condition. So what that means is that there are no exclusions for pre-existing conditions. Again, I want to emphasize that because many people are worried about it. There are no exclusions, nor can your rate be raised, nor can you be dropped or your rate raised in the future because of your health condition. Now, under the Medicare Advantage plans on the left, those are network plans, much like what you've been under through PEB up to this point. They're PPOs and HMOs. They are network plans that include your Medicare Part A and B benefits. They are managed by the insurance company that you choose. And those benefits, again, most often do include your pharmacy coverage as well. On the right side, under the Medigap, your Medicare, your original Part A and B, will be your primary insurance under that type of a plan, and they are the first payer. Then the Medicare Medigap plan would pay after that, the additional 20% that Medicare does not cover. There are no network restrictions under a Medigap plan. You can go to any doctor or any hospital in the United States that accepts Medicare. Now, how is the process going to work? Well, first of all, it's a process of education. You're going to educate us, and we will attempt to educate you a bit more in how Medicare works and assist you to find the right plan through that education. Secondly, we're going to, right over the telephone, evaluate the different plans that are going to be some of the best for you, and then move forward to finishing your enrollment right over the telephone. Lastly, as I've mentioned before, we will continue to be there after July 1st to manage your health care needs, to work with you on any issues you might have with your HRA or changing coverage or appeals, network issues, whatever it might be. The education process began around the 1st of February when this Getting Started guide was mailed out to you. Each of you should have received one of those. It's a workbook for you to gather information such as the prescriptions that you take on an ongoing basis. Again, it's going to emphasize to you that pre-existing conditions will not limit your plan selection. And then a place for you to write down for your evaluation and enrollment appointment. So go ahead and give us a call. I will give you that phone number later in this presentation, but also know that we will be calling out to you. So please do welcome that call from the benefit advisors. They're calling to start this process with you beginning in early February. More education. In late March, you will receive in the mail another booklet called the Enrollment Guide. So when you see these big white envelopes with blue lettering on them come in your mail, know that they're very important. Please do open them immediately and save them and read them. This enrollment guide is there to prepare you for your enrollment discussion, review the Medicare basics, and if you've set up an individual appointment, it will have a cover letter with a confirmation reminder. That booklet will arrive in late March of 2011, just before we start the enrollment period. Now, we will help you to evaluate and move forward into enrolling. And the people that do that we call benefit advisors. They are located here in Salt Lake City, Utah in our offices, and they will be your objective advocate. They are unbiased in this. They don't care what company you enroll in or what type of plan, as long as it's the one that you want and is the best for you. Their compensation does not change regardless of the type of plan you enroll in. They're paid on an hourly salary basis, and so it doesn't matter to them. We want them to be completely unbiased. They will be your single point of contact here in Salt Lake City. We're very, very proud to say that they are the most thoroughly trained benefit advisors in the Medicare industry. And they are available to you Monday through Friday from 6 a.m. until 6 p.m. Pacific time. Now, most of the PEB retirees still live in Nevada, but there are about 2,500 of them that live around in other areas of the country. So you would need to just look at that based on the time zone in which you live. But those benefit advisors are available 12 hours a day, Monday through Friday. The benefit advisors use some very sophisticated support tools that we call Help Me Choose and the Prescription Profiler. Help Me Choose is a series of questions to help us surface quickly what's going to be generally the best plan for each of you. The Prescription Profiler helps us to analyze what plan covers the most of your prescriptions and, more importantly, what's going to be the best value for you in a prescription plan. That's why we need to gather your prescription information. The enrollment process again begins on April 1st of 2011. Now, the benefit advisors can discuss coverage options with anyone if they have your permission. They can discuss with a spouse or a son or a daughter or a trusted neighbor or pastor, whomever it might be. However, we must have the enrollee on the telephone to complete the enrollment at the end of that process. Once you've made a coverage selection, then the enrollment is conducted via that same telephone call. 100% of the calls into and out of our call center in Salt Lake City are recorded, and that is for your protection.